Welcome back and thank you for staying with Times Now. The Union Health Ministry has confirmed the detection of 2 new cases of Nipah virus in the state of West Bengal, leading to heightened screening across airports in the country. And a quick action plan has also been put in place to control the spread of the Nipah virus. The Health Ministry has confirmed that 2 patients have been isolated and are currently stable as they are being treated, and nearly 200 others have been quarantined. But they were also found to be asymptomatic and tested negative for the virus. Authorities have stepped up the vigil, even as the World Health Organization has labeled the risk as moderate. As concerns are growing, it is also time to take precautions, but also ensure that one must not panic. We're going to tell you more about the Nipah virus and why you should also take adequate precautions. How does the Nipah virus transmit? It is a zoonotic virus which is transmitted from animals. It is transmitted from fruit bats and also flying foxes. How does it infect? Now, it incubates in the human body in about 5 to 14 days. The first symptoms occur within the first 3 to 4 days. What are the symptoms? The symptoms are fever, it's headache, it's respiratory illnesses, it's also convulsions and also mental confusion, brain inflammation in severe cases. When it comes to the fatality rate, what do we know? The death rate is anywhere between 40% to 75%. Naturally, one would wonder then, when the fatality rate is quite high, is there any cure for the Nipah virus? Unfortunately, at this moment, there isn't any one cure that is globally accepted by reputed health bodies. However, doctors across the world have used different methods to treat the virus. No approved treatment or vaccine are currently available. Patients are treated with antivirals. In the state of Kerala, remember, it was remdesivir that was used when the 2023 outbreak had taken place. Now, remdesivir also led to improved case fatality rate. Now, while the spread of the virus remains largely minimal, it is also important, viewers, for us to take adequate precaution to stem the spread of the Nipah virus and also maintain good health. So what can you do to contribute to India's mission to control the spread of the Nipah virus? Let's tell you what you can do. This is about precaution. Avoid any kind of direct contact with fruit bats. The other precaution that you can take is do not eat partially eaten fruits. Another precaution that you must keep in mind is that you must avoid consuming raw date palm sap. Another precaution that that doctors have always advised is wash your hands with soap regularly. Then you should isolate suspected cases immediately and also use PPE kits while caring for patients. Let me go across to my colleague Rajesh. Rajesh, there is an alert, and the Health Ministry, I beg your pardon, has also confirmed that 2 patients in West Bengal have tested positive for Nipah virus. What is the kind of coordination that is currently underway between the state health authorities and the central health authorities, and what are the measures that the state government has taken and has put in place to ensure that there is no widespread of the Nipah virus?
See, since only 1 patient is currently admitted at the hospital in West Bengal with Nipah virus, right now I'm present in front of that particular private hospital located in Barashat, and the two patients were admitted at this hospital a few weeks back. Right now, only 1 patient is admitted at the same hospital with the infection of Nipah virus, and another has already been discharged. 2 patients were the employee of this particular hospital. They are nurse by profession. One is male and one is female. The male patient has already been discharged, and the hospital sources has said that after seeing all the significant clinical improvement, he has been discharged and he has remained completely stable after taking all the antiviral courses, and he was given all the required medicine. He was in the hospital isolation few days back, but after being stable with no requirement of oxygen, he was mobilized out of bed with close clinical monitoring by the senior doctors of this hospital, and after showing all those improvement, the male nurse has been discharged from this hospital. Now the only female nurse is currently admitted at this hospital, and she still remain in ventilation with oxygen support.
Two patients, one of the patients who had tested positive had also undergone treatment at a private hospital in Barasat. The male nurse has now been discharged, and the other patient is still under observation. Thank you so much, Rajesh, for getting us all those details. With that, it's time for us to take a short break.